Hello, my name is Theresa Barron-McKeagney, and I'm the director of the University of Nebraska at Omaha School of Social Work. Today I want to talk about healthcare and our social implications with regard to that. When I think about healthcare, I realize that we haven't been very wise in the decisions making that we've done over the past several generations. I'm also reminded of when I was a graduate student and I studied Carol Gilligan. And Carol Gilligan wrote a book in a different voice. She worked with Kohlberg at Harvard University, and Kohlberg's whole issue about how men make decisions are based more or less on law and order, follow the rules and everything will be fine. What Gilligan felt was that women have a whole different decision tree in terms of making decisions that impact their lives and the lives of their families. And she said not everything is in black and white, and that we have to realize that there are gray areas. And so that's what I'm thinking with regard to health care, is that we haven't really looked at the decisions that we've made in a holistic way for very long. We've always tried to follow the rules, try to be orderly, and in that, a lot of greed and a lot of unfortunate capitalism has taken place with regard to the way that healthcare has been delivered. If we were more holistic in our approach to understanding healthcare, perhaps we wouldn't be in the situation we're in. I'm also reminded of our indigenous brothers and sisters who have over the years said any decision that we make today will be impacted by those generations 7 generations from now. And so as they think through their decisions, they're very aware of what they need to be able to do to provide for a safe life for those people in the years to come. Again, I'm reminded that if we use the same philosophy with regard to health care, we would not be in the situation we are in today. But again, unfortunately, our greed and the greed that has existed in our healthcare programs have unfortunately caused that to be the situation that we're in right now. So when we think about any kind of social impact that affects us because of our healthcare crisis, I think of my work as a social worker. Everything that we do in social work is impacted by the systems that we work with. And so not only is it healthcare, but it's education, it's hopefully the eradication of poverty, it's the issue of the criminal justice system where so many people are incarcerated in our country today, the economic crisis. And so all of that is impacted again and burdened by economics. And so if we were able to change our attitude toward how we look at providing a healthcare system that's more stabilizing for people, our country would be in a much better situation. And so the suffering will continue until we're holistically looking at what we need to do to provide a better healthcare system for everyone in this country.